we've just got a definition of self-harm from the NICE guidelines, which sort of encompasses all what we've been saying really about it could be a self-poisoning or self-injury, irrespective of the apparent purpose of the act. So again, I guess that's about not generalising around why that person is doing it, but really about looking at individually what it is about for that young person. We're just going to touch on now about the two pathways. So you've already learnt from Julie about the acute pathway, and then just again about the new pathway that's been launched today. We really want to use these in conjunction. So in a few minutes we'll work with a scenario where you'll be able to use lots of the resources that are in here. But one of the ways is using this really as an assessment tool, not only with the young person, but maybe their family and other all school staff. And that can be used, I guess, if you're going to it needs to go to a CAF and the complex case meetings, or if unfortunately they do become part of the acute pathway, all that information is so positively used within that, and it can be used as one. So, as I said, we'll look at the resources within that later and how they can be used.
So if we move on to having a look at the schools and community pathway, you should have a copy of these on your table. We apologise for the small print of them, but it's a fairly detailed pathway that we wanted to try and get onto a one-page document for you. As has been previously mentioned, these resources are available in electronic copy and downloadable from the Ask Norman website, so you'll be able to play with that to suit your needs, so you can perhaps see it a little bit more clearly and perhaps print it in a slightly bigger version. But just to walk you through this really, we wanted to kind of raise some particular aspects around the schools and communities pathway. And today really does serve as an introduction to this area. It's something that had we the time, we'd like to go into in more depth in terms of the background around self-harm and how that fits into the work that we've developed. And there is training coming up in the area around self-harm on the 15th of October, which again is publicised through the Ask Norman website and through the Northamptonshire TAMS website, which is an in-depth day's worth of training around self-harm and its presentation and looking at practical support strategies as well. So what we want to do today is to kind of touch upon that and introduce you to the pathway and the work that we've been doing as a team, and look at ways that are positive in terms of hopefully using this documentation to help to guide practice. It is guidance, and it's there to be used in a way that is applicable to your settings and with the children and young people that you work with. The flowchart here, really, it's not an either-or option. So as some flowcharts gives you a yes or no and you go down one strand, you may find yourself going down multiple strands on this pathway, and I think that's an important thing to mention, that actually this is here as potential guidance and potential things that you may want to think about. You may find yourself covering each of these areas with a child or young person, or it may be that one is sufficient. The first thing to say is obviously on the left-hand side of the screen and of your document in the yellow, if you are concerned about a child or young person who has communicated that they've taken an overdose or intends to take an overdose or have taken an overdose, please follow your emergency procedures. That's really important just to mention that obviously if you are in doubt or if you feel that it is serious, do use the 111 numbers or 999 if you feel that an ambulance is necessary. But if a child or young person has communicated to you a different kind of incidence of self-harm, if you look below in the red areas, we've talked about listening to children or young people as being the first port of call, opening up those channels of communication. And as we go through the pathway, you'll notice on the pathway document there are actually links underneath each area that link back into this toolkit. So where we're saying listening to a child or young person, we're hopefully not just leaving you to interpret that. We've given you some guidance around things that you could use, if useful, to help you in listening to that child or young person. Within the toolkit, there are scripts for communicating with a child or young person, questions that you might like to ask them, ways of opening up channels of communication depending on that child or young person's needs. Julie mentioned earlier about the presentation of a case where there were risk factors already within that child or young person's story. Within the toolkit, there is a risk and protective factors checklist document, which if you have concerns around a child or young person is a really useful tool to have a look at and go through and analyse what's going on for that child or young person in their life at this moment. Are they a potential person who is at risk? Obviously, we're talking about within the pathway those children or young people who have communicated self-harm or an intent to self-harm. But there are also lots of very useful tools within the toolkit for just those children who you may be concerned are at risk of self-harming as well. So not forgetting that we are, yes, being reactive to those needs that we see, but we're also being proactive in hopefully minimising the incidence of self-harm and supporting these children and young people at a very early universal level. One of the other things that we really want to emphasise in terms of the pathway is as you move down from the listening to children and young people, you'll notice that it says referring to the school self-harm team. One of the things that we particularly would hope to see in schools and community organisations is practitioners working as a team in this area of work. It's a hugely difficult, often distressing and anxiety-provoking area of work with children and young people. And it's really important that we support each other as practitioners and that we actually have that support both for ourselves as professionals but also to make services as effective as possible for children and young people. Because the daily logistics of life are that you might be away, something might come up, shifts may change, all sorts of things might happen in the workplace, which means that you as a singular person may not be available to that child or young person. So if we can be working as teams, it can be that much more effective in providing support to children and young people across your settings. As part of that, we've also mentioned, ideally, that self-harm team fitting in very closely with the safeguarding team or the designated safeguarding officer within your context. And the importance of that, if there are any concerns that do come up around safeguarding as part of your analysis of the child or young person's needs. As you kind of move down, you'll see that there's information around considering informing parents and carers and what you may do around that question. We've encountered different practice in different settings around that query, and it's often something that can be a real challenge for practitioners working directly with children and young people. Within the toolkit, again, you will see on that box that it refers to particular forms to guide you in that area. There are scripts for communicating with parents, both via telephone and via letter. There's also guidance around actually communicating that back to the young person, the need to do that. All of those kind of things that may come up, particularly with adolescents who may feel particularly strongly around that kind of issue, and it may be a very delicate issue that you come across. So hopefully you will find some useful guidance within the toolkit around that as well. As you move across, I've mentioned already about possible safeguarding referrals, possible use of CAF, again, as a model to support around a child or young person where you have concerns. There is also, we look at risk assessment in this area. There's a lot of hopefully useful content within here around risk assessment. And the paperwork has both risk assessment and incidence forms around that. There are also support plans within the documentation around things that you can actually put in place as a proactive plan of support for a child or young person within a setting, so that actually staff are aware of the kind of nature of support that a child or young person may need. That may not necessarily mean that they're aware of why they're receiving that particular support. They may not need to on a confidentiality basis, but they can be aware of the support strategies that are being put in place. It also moves down to consultation with other professionals, looking at consultation perhaps with CAMHS liaison line or ongoing referral as well. We also mention as well in the corner about consideration of your thresholds and pathways documents which exists within the county and how your concerns may fit in within that and how that may relate back to your safeguarding procedures as well. So having covered most of those, we're just looking around obviously the self-harm team elements and ongoing referral and all of those different elements.
Okay. So as Emma's touched on there really, although the toolkit has been developed within Northamptonshire, we've actually taken guidance from regional and national guidelines that are out there really to put this together. And it's really bringing a national perspective as well. There's on page 22 here, there's examples of policies that can be taken into schools and used. So if you have a look on there, that might be worth something for schools to look at. And as it said, the tool can be used very much as in a preventative measure, but also in a supportive capacity as well, like we've said, as a good whole assessment tool.